Think Kidneys is the national programme to improve the awareness and the management of acute kidney injury. It's about how do we prevent acute kidney injury, how do we better detect it, how do we understand who's at risk, and how do we educate the public, patients and professionals about acute kidney injury. Over the last 2 decades, the numbers of people who sustain acute kidney injury in hospital is dramatically rising, and this represents the complexity of healthcare today with complex drug medications and the fact that people have long-term conditions that predispose them to having acute kidney injury. We know that it's harmful. It hurts people, it can lead to premature death, it can lead to delayed recovery from other illnesses, and it costs a lot of resource in terms of professional time and money to look after people with acute kidney injury. Kidney disease itself is very difficult for the public to understand, and in fact people's understanding of what the kidneys themselves do is very limited. Only about half of people know that the kidneys produce urine, and yet that's at the heart of the problem about acute kidney injury. So for Think Kidneys, this is not about specialists. This is about how do we educate anyone who may come into contact with someone who's at risk of acute kidney injury or may have acute kidney injury. We have 2 broad objectives when we consider what the issue is. We want to reduce the number of people who have acute kidney injury, so that's prevention, but we also want to improve the management of people who have acute kidney injury, because for some people we can't prevent it.
Acute kidney injury is the condition that was previously known as acute renal failure for people that graduated from medical school in years gone by. It's associated with an abrupt loss of kidney function that can occur over hours or days. And whilst it sounds like it may be associated with trauma, that's really not the way that acute injury occurs. Acute injury occurs in the setting of a decrease in the blood flow to the kidneys. That leads to a change in the ability of the kidneys to function, and that leads to a change in the biochemistry. If that's not recognised really quite quickly, that can progress and the kidney function can deteriorate further, and indeed the kidneys can be damaged really quite severely.
In most instances, acute kidney injury occurs in the elderly population. This is because they suffer from a lot of chronic disease, such as high blood pressure, diabetes, and also they take a lot of medication which can affect the kidney. Most importantly, the patients who already have kidney disease or chronic kidney disease are most at risk. It can also occur in those patients who are at risk of infection, such as septicemia, and also those patients who have had surgery. What this means is that acute kidney injury can occur wherever the patient may be. We know that 65% of acute kidney injury occurs in the community. Therefore, it's really important that as primary care physicians, we know how to detect acute kidney injury and therefore prevent it from happening in the first place.
The Think Kidneys programme is trying to support healthcare staff to recognise acute kidney injury more promptly, to enable them to manage patients far more effectively. Part of that is promoting proper educational programmes to ensure where good practice has occurred, that this is shared across the NHS and that people recognise what they need to do and when they need to do it. Furthermore, there's publication of materials and indeed materials available on the website which will help people identify those patients at risk, ensure that patients who have conditions that increase their likelihood of developing acute kidney injury are recognised promptly and therefore are more likely to get appropriate treatment at the right time. Of course, in the working day, there's lots of pressures, and so the third thing that's been developed by the programme is ensuring that there is an IT algorithm that allows patients who are developing acute kidney injury to be notified back to the clinicians looking after them. This is developed in conjunction with our laboratory colleagues because, of course, most acute kidney injury is identified by blood tests. Where there is a type 1, type 2 or type 3 acute kidney injury developing, there will be a notification to clinical staff and an expected delivery of a response to avoid the patient developing complications. We need to highlight to the general public, but certainly people in risk groups, what the kidneys do and where they might be at risk. In addition to that, we would hope that we'd be able to identify to individuals what they can do to protect their kidneys the best way possible, given that in a risk group, that risk needs to be ameliorated as best possible, and certainly in certain situations. So we need to ensure that a publicity campaign does transmit to the general public what the kidneys do and help them protect the kidneys. Indeed, the kidneys are quite amazing organs, and we need to ensure that people know that they have to preserve their kidney function the best way possible. The only way they can do that is by increasing their knowledge.
It really came as a real shock to me to find out that I had acute kidney injury, because I had been very fit and I'd started to experience, when I was walking long distances after 5 or 6 miles, some pains in my legs, and they had got steadily worse. And then I'd gone through a period of sickness, and during which my urine had turned pink, and then over a week and a half I stopped weighing at all, and the diagnosis of no kidney function was made in the emergency admission unit of Burton Hospital at 3 o'clock in the morning. I was very poorly, I was very confused, and when I woke up and was a bit sensible, the doctors kind of said to me that I needed to start thinking, because I would need either a kidney transplant or dialysis, probably to enable me to keep living. When I first got out of hospital, it was really difficult because I'd been very poorly, but over the next 6 to 12 months, I've gradually got better and better. I come into the hospital on a quarterly basis now. That has been 6 weeks. I'm now able to do most things that I would usually do. I am working full time. I'm also pleased to be able to have got back to my walking. I can now walk up to about 6 or 7 miles. I've also recently managed to get my bike out, and I had about an hour on the flat on my bike. So I am able to do most things at the moment that I would do. I'm not able to take any salt in my diet, and I'm not regularly drinking any alcohol. But other than that, in a limited way, life's reasonably normal.
Acute kidney injury is a serious problem. We need to understand that the burden on people's health and well-being is huge, that there's a lot of work to do, but this programme is leading in that effort. To give you some context, 1 in 5 of people who come into hospital as an emergency will have acute kidney injury complicating their underlying problem. And that complicating factor brings with it additional cost to the system, but most importantly, it brings harm and suffering to the individuals. So the task is large, but I am absolutely convinced that the NHS is the right system to be able to tackle this and to show the rest of the world how best to manage the situation. 18 months ago, when I gave my first interview around this programme, I was asked what my ambition was, and it was simply this: it was to have acute kidney injury in the consciousness of anyone who would look after someone who was at risk of or who had acute kidney injury. So the ask for you is, do you know enough about acute kidney injury? If you don't, it's about using the resources that we have produced or that your local teams have produced to understand more about the problem. If you're involved in projects, it's around engaging with us to tell us what you're doing and to help us improve outcomes for individuals. We all need to know about it, be it for ourselves or for the people we look after. Talk to us, use our website, understand what the issues are, but most of all, spare a thought for that hard-working set of organs within your body, the kidneys.